Ruptured aneurysms are becoming less common, but we still see them. Ruptures occur in about 10 per 100,000 men per year. In absolute numbers, more ruptures occur every year in men, but women are slightly more prone to rupturing if they have an aneurysm compared to men. The main risk factor for aneurysm rupture is the maximal diameter of the aneurysm in centimeters. Aneurysms less than 4 centimeters in maximal diameter rupture at a rate of less than 0.1% per annum. By the time an aneurysm reaches between 5 and 5.9 centimeters, the risk of rupture increases to between 3 and 15% per annum. For aneurysms between 6 and 6.9 centimeters, the risk is between 1 in 10 and 1 in 5 of a rupture each year, and the risk of rupture increases as the diameter increases thereafter. Other risk factors for rupture include rapid expansion, which we define as expansion of greater than 0.5 centimeters in the diameter over 6 months. Aneurysms with a saccular morphology are more prone to rupture. Patients who continue to smoke or those with uncontrolled blood pressure are also more vulnerable to rupture. And as we said before, aneurysms in women seem to expand a little bit faster and so are more likely to rupture. How do you recognize a ruptured AAA clinically? The classic triad is sudden onset back or abdominal pain, combined with hypotension and a pulsatile abdominal mass on examination. But this classic triad is actually only present in 1 out of every 2 patients with a rupture. What other presentations should you be on the lookout for? Well, sometimes a retroperitoneal leak will be contained but irritate the adjacent ureter or kidney and mimic renal colic. So beware the middle-aged man with renal colic who has no blood in his urine. The sharp drop in blood pressure caused by an initial leak might result in fainting, and then as the leak seals itself off for a while, the patient recovers consciousness and is just complaining of a bit of back pain. On rare occasions, the leak may occur into the adjacent inferior vena cava, and the patient may present with features of high-output cardiac failure. If you suspect a ruptured or leaking abdominal aortic aneurysm, you need to get imaging to confirm. But remember, ultrasound can only tell you whether an aneurysm is present or not. It cannot tell you whether it is ruptured. To rule out a rupture, you need to get a contrast CT. Don't forget to like and subscribe. The revision notes are available free at vasculartutor.com.